Hey there, nursing students. Getting ready for that Week 13 quiz in NSG 331? Well, you are in exactly the right place. Today's explainer is a high-yield, purely clinical review of loss, grief, and end-of-life care. We're going to take all that dense source material and break it down into a really clear, visual presentation so you can efficiently review the Week 13 content and absolutely crush these concepts before exam day.
But before we really get into the weeds, I want you to chew on this for a second. What is the actual difference between loss and grief? I know, it sounds super simple, right? But in a clinical setting, being able to distinguish between the objective reality of losing something and the messy human reaction to it is foundational to how you assess and care for your patients. So keep that question in the back of your mind as we go.
All right, here's our game plan for today's review. First, we'll cover understanding loss and grief. Second, frameworks and types of grief. Third, the nurse's role. Fourth, palliative versus hospice care. And finally, end-of-life decision-making. Let's kick things off with Module 1, Understanding Loss and Grief. You know, people throw around the terms bereavement and grief like they're the exact same thing, but clinically, they are totally different. Bereavement is actually an objective, measurable thing. It's simply the period of time after the death of a loved one. Grief, on the other hand, is the complex, multidimensional response to that loss. It's the normal human reaction, which obviously includes psychological stuff like anger, guilt, and anxiety, but it also includes really powerful physiological reactions too. We're talking sleeping problems, changes in appetite, even physical illness. As a nurse, your job is managing all those complexities of grief during the patient's period of bereavement. Moving right along to Module 2, Frameworks and Types of Grief. Okay, you've probably heard of this one. It's the Kubler-Ross 5 stages of grief: denial, anger, bargaining, depression, and acceptance. Now, the absolutely crucial thing to remember for your exam here is that patients do not process these in a neat, linear order. They don't just check them off a list. People bounce around between these stages constantly, and understanding that nonlinear progression, that forms the absolute bedrock of a good grief assessment. And that messy, nonlinear reality is echoed perfectly in the grief wheel. This framework maps the journey from a baseline normal state, spiraling through shock, protest, disorganization, and reorganization before finally arriving at a new normal. It's a great visual reminder that while equilibrium is eventually restored, the patient's baseline is just forever changed. All right, let's do a rapid-fire vocabulary sprint, starting with anticipatory grief. This is the heavy emotional processing that happens in advance of an impending loss. Basically, it's the grief that patients and families go through before the actual death even occurs. Now, on the flip side, if that grieving response is immediate, intense, and really sharp, we classify that as acute grief. When you think of acute grief, picture that highly visible, deeply visceral reaction right after a loss actually happens. Then we have shadow grief. This refers to grief that lingers in the background and can be suddenly triggered long after the initial loss. It's those shadow feelings that can just surprisingly resurface down the road, maybe triggered by an anniversary, a familiar smell, or just a random memory. Now, here is where you really need to put your clinical hat on. You must be able to identify clinical danger, and prolonged or complicated grief is a massive red flag. This happens when those acute grief symptoms just do not lessen over months or even years. It paralyzes the patient, causing extreme difficulty in daily routines, self-isolation, and it can even trigger a new or reappearing major depressive episode. We're going to wrap up our vocabulary sprint with disenfranchised grief. Honestly, this is a uniquely painful experience. It happens when a loss cannot be openly acknowledged, socially validated, or publicly mourned. It's a situation where society essentially fails the griever by just not recognizing their right to grieve in the first place. Okay, quiz time. Let's see if you can apply this vocabulary with a clinical judgment scenario. The spouse of an older adult with a terminal illness tells the nurse that the couple has sold a number of their belongings and moved into a retirement facility. What description of grief best describes the situation? Take a second and think about the definitions we just covered. Did you guess anticipatory grief? Because if you did, you nailed it. The spouse is actively preparing for an impending loss, and that mental preparation is physically manifesting in major life adjustments before the loved one has actually passed away. Really great job if you caught that. All right, shifting gears a bit, let's look at Module 3, the nurse's role. Your clinical practice, and honestly your exam, will rely really heavily on the 6 C's approach for promoting healthy aging and dying: care, control, composure, communication, continuity, and closure.
Supporting the dying and their families isn't just about saying, "I'm so sorry for your loss." It is a highly structured, intentional nursing responsibility. It's about maintaining their dignity, actively listening, and ensuring they're absolutely not abandoned in the process.
Module 4, Palliative versus Hospice Care.
Listen, this is a stark, highly testable topic, so pay close attention. Palliative care allows for simultaneous curative treatment and can be initiated at literally any stage of an illness. Its main goal is symptom management and improving quality of life. Hospice care, however, that means there is no further curative treatment, and it specifically requires a life expectancy of 6 months or less. Hospice is entirely about easing distress and living fully and comfortably until the end. You absolutely have to know this distinction cold. Let's test that out right now. A terminally ill patient asks the nurse what hospice care entails. How should the nurse answer? Think about what we just discussed regarding the core philosophy of hospice. The absolute best response is that hospice care provides holistic care aimed at promoting comfort. This brilliantly illustrates that hospice is fundamentally about compassion, dignity, and easing physical and emotional distress. It is completely shifting the focus away from treating the disease process and entirely toward comfort. And that brings us to our final section, Module 5, End-of-Life Decision-Making. In end-of-life care, you're going to encounter a lot of specific code orders. A full code means all heroic measures are taken. D&I means do not intubate. A chemical code means you're using resuscitation drugs, but no physical CPR. And finally, no code, which is your DNR, do not resuscitate, or AND, which stands for allow natural death. That means comfort measures only. Just remember, your job as a nurse is to impartially support the patient and family in these decisions and meticulously document their informed choices.
Another legal directive you really must understand from the source material is physician-assisted suicide, or death with dignity. This occurs when a physician provides the means and information for a terminally ill patient to self-administer medication to hasten death. It is crucial to note for your exam that there are extremely strict guidelines to qualify for this, and an absolute critical requirement is that the patient must self-administer the medication themselves. I want to conclude this explainer with a really profound thought from your source material. Death is not the problem, dying is the work. While your upcoming quiz definitely requires some rigid memorization of terms, models, and code orders, your future clinical practice will require immense human empathy. You are the professional guide helping families do this deeply difficult work. Review this material, master these concepts, and you will do incredibly well on your Week 13 exam. Keep learning, keep pushing yourselves, and I'll see you in the next explainer.